So my clinical pattern was adhesive capsulitis, and what it is, it's an insidious shoulder disorder that is accompanied by inflammation of the synovial membrane of the glenohumeral joint, and it leads to thickening and fibrotic changes. The age group that this mainly occurs with is during the fourth and the sixth decade of one's life. It's more common with females, and some outcome tools that you can utilize are the DASH and the SPADI. When it comes to the onset, as I said earlier, it's insidious. However, it can occur after shoulder pathologies or immobilizations, and also it is seen to be correlated with diagnoses of diabetes and hyperthyroidism. Some aggravating factors with adhesive capsulitis include general shoulder motion, sleeping positions, especially if you're on the side that is affected, pain during gait with the arm swings, and then some factors that are easing include heat or NSAIDs. When it comes to the 24-hour pattern, it depends on what stage of adhesive capsulitis the patient is in. So during the earlier stages or the freezing stages, pain will be more common. So during rest, during activity, during the frozen stage, pain will be more common whenever you're going into those end ranges of motion. And then during the thawing stage, that's when pain starts to be pretty low. And then when it comes to the precautions and contraindications for the exam, there isn't really any specific ones, but something to keep in mind is what stage of adhesive capsulitis the patient is in. Those earlier ones, you want to be more conservative when it comes to not wanting to push the patient too far when it comes to passive range of motion, and also just gauging where the patient is at, asking how they're feeling, ensuring that you're not causing so much pain where you're exacerbating their symptoms or causing more inflammation. And then when it comes to the physical exam, such as the active movement testing, what you'll experience and notice is decreased flexion, abduction, internal and external rotation. During the earlier stages, such as the freezing stage, the patient is likely to have pain throughout the range of motion. When it comes to the frozen stage, they're likely to have pain at end range motions. And when it comes to passive movement testing, you're likely to see the same limitations in flexion, abduction, external and internal rotation, and the end field will be firm and painful. When it comes to resisted testing, you will likely be unable to perform true MMT measurements because of inability to get into the testing positions. For accessory motion testing, if you're able to do them, hypomobility is likely to be present in all directions of the glenohumeral joint. When it comes to neurodynamics, you might want to rule out cervical radiculopathy pathologies. However, another issue that comes around here is inability to get into the testing positions. So you just might have to gauge that. When it comes to special tests, there aren't any specific special tests for adhesive capsulitis. However, you might want to do other ones if able to rule out other pathologies, such as cervical radiculopathies or rotator cuff impairments, impingement, those things. And then when it comes to palpation, some of your findings will be tender overall glenohumeral joint, deltoid supraspinatus tenderness, trap tenderness, and then also coracoid process tenderness. When it comes to differential diagnoses, some of them include primary or secondary arthrosis of the shoulder, acute calcific tendonitis or bursitis, cervical disc pathologies, OA of the shoulder, and then some signs and symptoms that may indicate a referral to the physician could include not having any improvements in the patient for those first 6 to 12 weeks in physical therapy, and then also any presentation of red flag signs, such as constant night pain, night sweats, unexplained weight loss or weight gain, and then fever. And then lastly, some surgical indicators for adhesive capsulitis include manipulation under anesthesia and then surgical release of the capsule. These kind of just are surgical methods in place to decrease the adhesions, decrease pain, and then possibly improve range of motion and function. The surgical release of the capsule one, that one's more utilized for severe cases of adhesive capsulitis.